health and safety is a fundamental human right, and I can say that this year because this year the ILO affirmed that health and safety is a fundamental right, and it will be added alongside the other fundamental rights and ensure that health and safety becomes a priority for every country around the world. I also want to acknowledge the role that health and safety reps play, and I'm going to talk a little bit about the safety effect in terms of health and safety reps, but the work that you do on the front line saves the lives of thousands of people every year. I don't think I can understate enough the important role that health and safety reps play. It is often a thankless task. It's something that I know, speaking to a few over lunch, you're empowered by your colleagues to go and make arguments for employers about why things should be improved, and it can be a very lonely job. And I know as a unionist I'm very grateful for the last 20 years that I've been supported by great health and safety reps, and I really wanted to acknowledge the work that you all do. But the purpose of today, was to cover off on a few key issues that are really important at the moment. So I want to start by giving you a bit of an overview in terms of the state of health and safety in Australia and give you a bit of an understanding about what's happening and some of the key trends that we're observing. I also want to cover off on what is really the focus of this session, which is the rise of mental health issues. And this is something that I think in terms of the stage that the country's in, we've seen a really big shift in the last 5 years about the importance of mental health. I think what's really important is to understand it as a work health and safety issue and understand the impact that work has on our mental health. I want to talk to you about some of the new protections and rights that we're about to see introduced. And it was great to hear Darren here talking this morning about some of the things that the regulator is doing around psychosocial hazards and mental health. But I think we're on the verge of seeing some really significant changes in our work health and safety laws around mental health, and I want to take people through that. And then finally I want to talk about some of the things we're doing as a movement to build the capacity of workers to actually win more mentally healthy work. So there's a few things there, and I think hopefully we'll have some time for questions at the end as well. So, let me get this right. So really, if we think about health and safety over the last few years, we should remember that every year around 200 workers lose their lives in workplaces. A construction worker loses their life every week in this country, and I know in the last few weeks we've seen a number of fatalities here in Western Australia. If we think about that in the context of deaths, what often doesn't get talked about, and it's great to have the Cancer Council here as well to talk about some of the impacts that work has on health, is that 5,000 workers die every year from diseases that are caused by their work. That's significantly more than we see in workplaces in terms of fatalities, and it's very much overlooked. Now, a big part of that number is asbestos, and despite having banned asbestos in this country nearly 20 years ago, we still see a rising number of people diagnosed with asbestos-related disease. And indeed, the number of people that die each year is still growing. We're seeing third and fourth wave infections and people diagnosed with asbestos-related disease that indicate that sort of near to medium term future will not see a plateauing of those numbers. What's equally troubling is the number of people that are dying from diseases other than asbestos-related disease. And we'll talk a little bit about silica later, and I think Cancer Council are going to talk about some of their work there. But silica is one of the leading causes of death in Australia at the moment. I was at Victoria's Workers' Memorial Day event back in April, and 1 in 10 deaths in Victoria last year were for silicosis. This is an entirely preventable disease. It's something that actually, from a modern country like Australia, we thought we'd long eradicated 20, 30 years ago, but has seen a resurgence. And not just because of engineered stone, we see it in quarrying, construction, mining. Workers are exposed across the board to hazardous dusts, and we do not have the protections that we need in terms of ensuring that workers don't contract these sorts of diseases. I think globally we often miss the figures when it comes to deaths, and every year 3 million people lose their lives for work-related causes. Now that's everything from asbestos, which still kills 250,000 people every year, but also things like long working hours, which is the biggest cause of worker fatalities every year, heart disease and so on. And indeed in Australia, if we think about the number of people that work what's considered excessive hours, so over 48 hours a week, Australia is not immune from these sorts of things either. If we think about injuries, 120,000 people last year made a workers' compensation claim for a serious injury. It's a lot of people. It's 1 in 100 making a claim every year for a serious workplace incident. And overall, we've seen a real plateauing and decline of physical injuries. But in recent years, we've seen both deaths and serious injuries rising. And a big part of that, in fact, probably the key driver of that, has been mental health issues. And we'll talk about that a little bit later. So, there we go. So, those were just the tip of the iceberg though. Those were workers' compensation statistics. And actually, as we all know, there are many more injuries that occur in workplaces that are not captured by workers' compensation statistics. So what we started 2 years ago was an annual tracking program called Work Shouldn't Hurt. And this is done two ways. Some people here might have seen it, might have completed the survey before, which is circulated by your unions, where we ask a range of questions about your own health and safety experience every year. And the purpose of this is to track workers' experience around health and safety year on year so that we can identify what are the key trends and issues that are occurring in workplaces and work with our unions and our affiliates to make sure that we can address some of those concerns. And we do it through two ways. One, as you've probably seen, our unions circulate a survey which gives them insights into what's going on in their sectors, in their states. But the second way is that we commission an external panel that is representative of the country to complete the survey each year. And these are some of the results that I'm going to take you through. It's just a bit slow though.
All right, I might just try and pull that up. Yeah. No, it's not worked.
Hold on a sec. Oh, there we go. We've got it working now. Sorry about that. So this just gives you an indication of sort of the representative sample that it is. As you can see, it covers all ranges of industries. It's very consistent with what the national profile of our industries is in terms of who it covers, both in terms of the age, the industry, the size of workplace, and also in terms of income. And what does it tell us? Well, it tells us, unlike what the workers' comp data, which said, as I said, 120,000 people injured at work every year, about 1% of the workforce injured at work every year, in actual fact, it's closer to 1 in 4 workers experience an injury caused by their work. Significantly higher than what's reported in our workers' compensation data, and significantly worse outcomes than even that data indicates. This gives you a bit of an idea as to the types of industries that are most prevalent in terms of injury, but what it also says is that about 7% of workers suffered a physical injury in the last 12 months, and 17% suffered a mental health injury. To give you a bit of a comparison, if we look at our workers' compensation statistics of all of those 120,000 injuries, it's about 7% of workers that are injured as a result of a mental health injury, and about 93% that suffer a physical injury. So there's a huge inequality in what's reported in our workers' compensation data, and despite the fact that mental health injuries are the fastest growing, they are still significantly underreported in our workers' comp stats. Women are more likely to experience mental health conditions caused by their work, men more likely to experience physical injuries as a result of their work. A big part of that story is also about the gender segregated nature of Australia's workforce. We have in fact, the most gender segregated workforce of any in the OECD, so we see a lot of these issues coming through in workers' compensation data, but also here in relation to this. If we think about the time that workers take in terms of injuries, what this showed us is that of those workers who did not take time off, 43% of, so 30% of workers, sorry, it's right, 30% of workers did not take time off as a result of the injury, 43% of workers did, and 27% of workers needed to take time off but didn't. A lot of that is as a result of insecure work and the fact that they do not have leave arrangements that would allow them to take time off as a result of an injury. So young workers were a really significant part of this research. What we found was that young workers, and this is consistent with a whole lot of other research, are more likely to be exposed to unsafe work practices, much more likely than their older counterparts, whether that be a range of hazards, whether it be repetitive work, standing for long times, or exposure to hazardous substances, chemicals, gases, solvents, young workers were expected to undertake much less safe work than older workers. Not working there.
Sorry,
All right.
don't know what I've done there.
Not sure. There we go. Just doesn't like being far away, I think is the answer. So manual handling was also a really significant issue for young workers. Young workers were much more likely to experience poor manual handling tasks than older workers. I said before I want to talk a little bit about health and safety reps, and one of the key things that's come through in this research, but in previous research that we've conducted, but also something that you read a lot about, is the importance of health and safety reps. Health and safety reps are the single biggest contributing factor to safer workplaces. And as this shows, in our research, about half of workplaces had elected health and safety reps. That's down a little bit from previous years, where it was closer to 2/3. But in those workplaces, there are significant differences in the health and safety compliance of employers. As you can see, you see in workplaces that had health and safety reps, much more likelihood that employers undertake regular inspections of work, much more likelihood that employers put as much focus on mental health as they do physical health. So when I said before that the work that you do leads not just to a lower exposure of risk, but to safer outcomes, this is all supported by the evidence that we've been collecting for a number of years. And where there was a health and safety rep present, there was a much higher likelihood that workers reported that employers dealt with issues promptly. So I think, again, a credit to everybody here and the many others that are not here today in the work that you do in holding employers accountable in terms of making sure that work is safe. So, there we go. So, mental health issues. I said before that we've really come to a point in Australia where mental health has sort of reached a tipping point. And if I think back even just 5 years, the conversation that the community is having around mental health is nowhere near where it's been in recent history. And what has really, I think, shifted has been issues around COVID. So obviously, we think about working from home and the changes that have happened, and indeed even in Western Australia, where you're immune from COVID for the first 12 months of it, a significant change when it comes to mental health. And I said before in terms of the issues around injury in workplace, but when we think about the mental health injuries that have occurred, about 1 in 5 workers have experienced poor mental health as a result of their work in the last 12 months. And that's consistent with previous years and significantly higher than what we see in our workers' compensation data. If we think about the sectors where this has been most evident, education, health and retail are amongst some of the higher exposed workers when it comes to poor mental health. And that's consistent with what we've been seeing when it comes to issues around frontline workers. These have been workers that have been unable to work from home throughout the pandemic. These are the workers that have been really on the front line when it comes to some of the challenges around managing the pandemic, especially on the East Coast, in our health system, education, but also in terms of retail. One of the big takeouts this year has been the issues around understaffing and the impact that that's had on mental health. So half the respondents who had experienced poor mental health said that this was largely due to issues of understaffing. And we see a lot of talk at the moment about just how tight the labour market is, the number of job vacancies that are available. And often this is seen through the lens of business and employers and economic growth. One of the things that's not talked about is the impact that that has on the workers that are in the workplace that do not have the staff to make sure that work is conducted safely. And a big part of this is playing out when it comes to mental health. There we go. And as I said before, young workers are much more susceptible both to physical injuries, as I said before, but in particular mental health issues, with 18% of workers aged under 25 and 23% of workers aged under 35 having experienced poor mental health as a result of work. this is a really significant issue for young workers as well. Right. So if we think about some of the key psychosocial hazards that workers are reporting exposure to, and I note the conversation that was had when Darren was here earlier about some of the experiences in schools, and it'd be really good to have a discussion about that when we get to questions a bit later. But there's a number of things that really came through in our research that I think are consistent with some of the stories that were being told earlier. So in 2022, we had really high rates of workers experiencing stress at work. And stress is an interesting one to talk about. Employers don't like talking about stress because it's quite a broad term, but I think most people here know what stressful work looks like. And I think it's pretty clear that we have a significant proportion of workers experiencing stress over the course of the last 12 months. Some of the key industries where we see that, again, consistent with the injury rates that we saw in terms of poor mental health, retail, health and education were really high in terms of those that reported stress in their workplace. But equally we see it in the public service, we see it in finance and education. And also we shouldn't think of this as necessarily something that is unique to office or white collar work. It's something that's also reported very strongly in industries where physical hazards dominate, like construction, manufacturing and mining as well. As I said before, key factors that really contributed to workplace stress was the lack of sufficient numbers of staff to be able to perform the work safely. Something that is being reported really across the board in terms of this. So again, thinking about adequate staff, retail, health, education, really high in terms of the numbers of people that are reporting adequate numbers of staff. Unfair work practices and change management is another key psychosocial risk that's being poorly managed. And we think about unfair work practices, that's everything from appropriate reward and recognition, so pay and conditions, but also the way in which overtime and other things get allocated is a really significant cause of workplace stress and poor mental health. But also changes at work being managed effectively. And obviously in the last 2 years, we've seen pretty significant changes occurring in workplaces, both in terms of managing the pandemic and making sure that work is safe, but also in terms of the disruption to industry, changes, redundancy, the way in which businesses have been restructured. Now these obviously have serious financial and economic implications for workers, but also have massive psychological implications for workers, both in terms of those who might lose hours or lose work, but those that are left also to pick up the slack when workforces are shrunk and so on. So these are some of the other key factors that we're seeing in terms of psychosocial hazards. One of the other things that I think is really important when we talk about mental health is often overlooked is the changing nature of work over the last generation. And this is not so much a story just of changing demographics, some industries declining and others rising. It's a story really of technology. If we cast back 40 years, the dominant occupation was an occupation that might be described as something that was manual and doing routine work. That was what the dominant occupation was. Over the last 40 years, that has declined, and what has come in its place has been occupations that would be described as cognitive, so requiring mental capacity, but also non-routine, so highly varied, very different day to day. And that's really a story of technology, and it's across industry. So even in industries where physical work is dominant, many of the manual tasks have been automated, and workers are left to do much work that is much more cognitively demanding. That means that when we think about work intensification today, it's less likely to be things that are speeding up and putting physical demands on your body, and more likely to be things that are increasing the mental and the cognitive demands on you. And that's a real story when it comes to some of the shifts that we've seen in relation to mental health. So technology sort of works in some senses. Yeah, definitely adding to my stress. So one of the other factors when it comes to poor mental health, and why we're seeing this rise in injuries across the board, and we should be clear, physical hazards, physical injuries have been declining for 40 years. We are doing very well at controlling, with some really notable exceptions like respiratory illnesses. We're doing a pretty good job at controlling and reducing exposure to hazards and therefore reducing injuries. But when it comes to mental health, we are doing very poorly when it comes to an injury rate. We've seen a massive increase in the last decade in relation to mental health, such that now it represents nearly 1 in 10 claims in our workers' compensation system. A big part of that, as I said before, is around the changing nature of work and the types of work that people are doing. Another part is around the unequal protections that mental health gets when it comes to physical health. And if we think about that in the context of your own act, as everybody knows, when it comes to mental health, we have an act that provides at a very high level a duty to ensure health so far as is reasonably practicable, and that health is defined as both your physical and your psychological health. But then when you move down through the tiers, there are no regulations when it comes to psychological health. They are all regulations that deal with the physical hazards of work. So whether it be manual handling, working at heights, exposure to harmful dusts, gases, etc., there are prescriptive regulations that tell your employer how they are supposed to manage hazards. When it comes to psychological health, there is nothing. There is a massive gulf between the high-level duty and there is some guidance that is very, very difficult for workers to enforce. So one of the big things as a movement we've been doing has been really about campaigning to close that gap. And a big part of that was around the review into our model work health and safety laws, which, as I said before, over the last 2 years in Western Australia, you've moved now to harmonise to. And we had 2 key recommendations that came from that review that dealt with psychological health. The first one was in relation to a regulation and a code of practice that would actually set out those prescriptive ways in which employers would be required to manage psychological health. And the second one goes to our incident notification system, which actually, in the case of Western Australia, didn't have as far to move as the rest of the country, because you actually have some really good things in your incident notification system that meant that psychological health had some capacity to being dealt with in ways that the rest of the country didn't. So what we've now got, and soon to be introduced hopefully in Western Australia, is a new regulation that deals with psychological health. So in the same way that employers have got very prescriptive standards that they must comply with in relation to physical hazards that I described before, there will now be obligations on employers to do the same when it comes to psychological health. So as with all risk management, they'll have an obligation to identify risks. And those are a few of them, but I'll sort of take you through some of these. Things like job demands, and that's job demands not just in the terms of the speed of work or the type of work that's being dealt with, making sure that we have sufficient resources to actually get through the tasks that are assigned, but it could be also the emotional demands. And I'm sure there are public sector workers, social and community service workers who are expected to do work that is really emotionally demanding. It might be dealing with difficult clients, customers. We talked about prisons before, which sounds like a fantastic workplace to do it, but we think about the emotional demands that places on workers. So employers will be expected to identify some of those sorts of risks. We think about the control that workers have got. So your ability to actually perform your work based on the level of control that you've got in terms of pulling together the resources to meet those demands. Those are going to be factors that employers have to identify in terms of risks. As a Western Australian, I'm sure things like remote and isolated work. So for workers that are working FIFO, these are risks that employers will need to identify. Rosters, the fact that you're away from your family for 2 or 3 weeks at a time presents really serious psychological risks that employers will be expected to identify and put in place things to control. So when I think about some of the really vexed issues that unions and workers have been dealing with and using our industrial system to solve for, this provides some very good powers now for workers to start to agitate for better conditions, for shorter rosters, for better access to facilities that might connect you to family and other things. things that we can now deal with much more effectively through our health and safety laws. So obviously it also goes to issues of bullying and harassment. We talked before about the schools example. Keen to share a story about what's happening in some of the other jurisdictions. So in the ACT, the health and safety regulator shut down 3 schools because those schools could not satisfactorily manage bullying and harassment by students of teachers. So the regulator went in there and said, no more in-person attendance for the next 3 weeks. And 3 schools were shut down in the ACT because they could not ensure the health and safety of workers so far as is reasonably practicable. Now, COVID's taught us one thing, we can do remote learning. If your employer can't provide you with a safe workplace, then they have to start taking action around these things. Now, these regulations will provide us with some more powers to start to address those sorts of issues. So those are some of the hazards that we know are going to be included in the regulation. Some of the controls, and this is where I think there's still a little bit of work to be done because this is by no means a settled issue yet. So what we want to make sure is that psychological hazards are dealt with in the same way as physical hazards. And as everybody here would know, is when it comes to regulating physical hazards, employers are required to control them using a hierarchy of controls. So that means that it's not good enough just to say to a construction worker that you could be exposed to things that are going to fall on you, so here's a hard hat. They have to take actions to ensure that those sorts of risks are controlled at their source. And what we want to see with these new regulations is the same obligations placed on employers to control psychological risks, which means it's not good enough just to have a policy in relation to bullying and harassment. You need to take active steps to ensure there are changes to the system of work that will eliminate, if possible, exposure to those sorts of hazards and control them and minimise them where that's not possible. Like any other regulation, like any other hazard, employers will have a legal duty to consult workers at the point of identifying hazard, at the point of how they intend to control them, and review them like any other hazard. So again, as health and safety reps, this is a really important part for everybody here to start getting across, is that making sure that as these regulations are being introduced, that you're actively involved with your employer to make sure that you're identifying the risks and controlling them in a way that you and your workmates think's acceptable. One of the other key changes was regarding incident notification. Now, I'll talk about it in the context of the model laws, and I'll talk about the differences that you've got here in Western Australia. So right now, under the model laws, incident notification provides a trigger. It's where an incident will occur in a workplace that requires notification. And that's a trigger not just in terms of its value of getting the health and safety inspector involved, and it's great that Darren was able to show up today and talk about what the inspector's doing. But we forget often that actually the objects of the Work Health and Safety Act are more than just employers ensuring that risks are managed and that inspectors are there to enforce them. It's also about facilitating the representation, consultation and cooperation with workers and health and safety reps. An incident notification provides a really important trigger for you because it creates what's called a state of knowledge in the employer that something has occurred that then needs to be managed. So expanding the incident notification provisions around mental health has been really important in terms of getting better action. And the current regime really fails when it comes to mental health, but also in relation to a lot of other cumulative and sort of chronic progressive types of incidents in terms of creating that sort of notification trigger. And currently it really only applies in a few certain circumstances. You know, when a worker dies at work, that's obviously a notifiable incident. Where there's a serious injury, in the harmonised states, in the model law states, and not in Western Australia, where there's a serious injury that requires hospitalisation, that requires notification. And where there's a serious incident that could have caused the death or serious injury of a worker, that also requires notification. You've got a slight improvement on that because in WA you've also got this 10-day rule, where if somebody is injured, that in the opinion of a medical practitioner could result in 10 days absence from work, that is also notifiable. Now that's not something that happens in any other state in the country, something we have been pushing for because it creates, again, a good trigger, but it also deals with mental health issues. Because often mental health issues don't happen from a single incident. They definitely, I'm not saying there are not incidents, obviously in terms of workers that are exposed to trauma, it is common, but quite often mental health issues manifest over a period of time. There are not isolated incidents which you can draw them back to. Similarly, when we think about exposures to a lot of diseases, so things like silicosis or other things, those are things that are happening cumulatively over time that never trigger the incident notification provisions. So now what we'll have is a new regime. So all of those things that you see on the left-hand side will continue to apply. There'll still be a serious incident notification. It will be expanded to include serious sexual assault and physical assault. Amazing to think that you could be sexually assaulted at work and that wouldn't require notification to the health and safety regulator, but believe it or not, that is the case. So that will be expanded to include it, but we'll also include a second tier of notification. And that's where workers are exposed to a range of psychosocial hazards or incidents in the workplace. So where an employer receives a complaint, they will be expected to notify that as well. There's still some detail to be worked out, but it's likely that will come in the form of some sort of batch reporting, where employers will be periodically expected to report to the regulator the number of different types of complaints. Now this is also going to be a really good trigger because for health and safety reps you can request that information at an aggregate level, not specifics around incidents. Obviously we need to also protect privacy, but it means that you can start to have a discussion with your employer about how are these issues being controlled. I noticed the discussion this morning, in particular around schools, was often about individual incidents, and that's really important. We need to make sure that incidents that are occurring in workplaces are properly investigated, that we review the controls that are in place. But actually what health and safety is most effective about is talking about systems of work. So where incidents are occurring, they're instructive because it makes us realise that the controls that workplaces have got in place to prevent those incidents are not working and they need to be reviewed. So one thing I would sort of encourage people to think about is where we have these incidents, move it away from the particulars of the individual incident and how the individual incident's being responded to, and instead expand it to a conversation really to say, clearly the controls that we have in the workplace are not sufficient to manage exposure to these hazards and we need to review them. It becomes less about the particular incident and gets bogged down into a particular bullying complaint and more about the systems of work that are occurring that allow these types of issues to arise. So if we think about where we are in terms of that sort of mental health journey, and we've talked about the changing nature of work over 40 years, the rise of mental health issues. 20 years ago we were talking about 2 or 3% of workers' compensation claims being for mental health. As of 2030, the Victorian government says that 30% of all workers' comp claims will be for mental health. Now that is not just a change in demographics, change in industry, that is fundamentally a failure to control hazards across all industries. So a significant problem there. We have a heap of new rights, new protections for workers that are coming. We're going to have a new psychological health regulation, psychosocial hazard regulation, a new code of practice which will provide practical guidance for employers about how to identify and control psychosocial hazards. The final piece of the puzzle is really around implementation and how do we ensure that with all these new rights and protections, health and safety reps, unions, workers are ready to make sure that employers are held to account and we see changes to systems of work. So a few years ago in preparation for this, the ACTU and a number of our unions started doing some work on how we can improve the sort of mental health capabilities of workers and health and safety reps, and we launched the Mind Your Head program. And what this is really about, it's about getting technology to work. Nope. Oh, there we go. Is really about building the capacity of workers and health and safety reps. So as I said before, and there's been a lot of statistics sort of thrown at you, we know that a lot of workers are experiencing poor mental health. Workers' compensation claims are some of the fastest rising claims in the country. They're also the most expensive. So when we think about what's happening to our workers' compensation schemes all around the country, they are bursting at the seams because we're seeing a rise in these claims. If we don't address it from a prevention point of view, my biggest fear is that governments will start to cut schemes. And that's because mental health conditions take longer to recover from and they are more expensive to treat. They are, in comparative terms, we think about the average time lost in terms of a mental health conditions, nearly half a year based on claims data. Compare that to a physical injury of about 10 weeks. When we think about the cost to treat somebody with poor mental health, it's about $43,000 per claim to treat somebody to return them to work. That's 3 times what it is to treat somebody for a physical injury. So there is a lot of incentive to get this right. There's a lot of incentive for employers as well to get this right, because it's not just those costs, it's significant improvements to productivity, absenteeism and so on. And it is estimated that mental health or work-related mental health costs the economy somewhere between $12 and $20 billion a year every year. So what Mind Your Head was also really about, it's about raising the priority of mental health. It's about making it sit equal to physical health in workplaces. And there are really 2 key things that we focus on here, and it's all about education. On one hand, it's about ensuring that systems of work, in terms of how we identify and control hazards at work, are present in our workplaces, but also that psychosocial hazards or mental health issues are incorporated into those systems of the work in the same way that physical hazards and injuries are as well. We design tools to create mentally healthier workplaces, and I'll talk to some of those in a moment. I know there's been a bit of work in terms of adapting those tools so that they're applicable in Western Australia. But a big part of the work that we do is about facilitation in workplaces, and that's with HSRs, managers and leaders to work together to create mentally healthier work. And it's using our health and safety system to do that. And we're also conducting a fair bit of research around the effectiveness of all of this. We have a comprehensive workplace program that we've been rolling out in a number of states around this. And the first thing that we do is we'll do a range of health and safety rep training. So as everybody here would know, you do health and safety rep training, and indeed you do a refresher every year, and it's really good. It teaches you all about your rights under the Act. But it is very much focused around the physical hazards. It doesn't talk about how we deal with psychosocial hazards. So a big part of what we do is about training health and safety reps on how to identify and control psychosocial hazards. We also do some research around that. We test in workplaces using what's called the Psychosocial Safety Climate Tool, which measures how psychologically safe your workplace is and benchmarks workplaces on an international standard. So you can benchmark both within your industry, within your state, but also globally as well. We then run a 4 days workshop, which is effectively, if I want to describe it in a way that most people understand, is effectively a health and safety committee. It is a 50% membership made up of management and 50% made up of workers' representatives, generally health and safety reps. And this is about identifying the psychosocial hazards that are present in the workplace and coming up with a prevention plan that will control those hazards. And then we take action. So we support workplaces to implement that prevention plan over a 6-month period, provide them the support in terms of ensuring that they stay true to the plan and ensure that it's all completed. And then finally we do an evaluation. And some of those are now just starting to come in, and we've seen a really significant shift in relation to the psychosocial safety of those workplaces. As everybody here would know, that's a pretty logical way in which most hazards get identified. And it's a framework that is really easily adapted in workplaces where you have really good systems of managing health and safety. Keep going. So, again, that gives you a bit of an idea of some of the training that we've developed. As I said, we have a health and safety rep course. We're looking to expand that. We're also looking to get it certified in a number of states so that we'll be able to have workers clocked off every year to undertake specific mental health and safety rep training. We also do a lot of work with frontline managers. I think what often is missed in the conversation is that frontline managers are often the meat and the sandwich when it comes to mental health. They have high expectations from more senior levels of management to deliver on certain goals around productivity that they know is what is hurting workers. they are often also the first point of call for many workers who are experiencing poor mental health as a result of that. And they struggle to deal with those competing demands. The training that we give them is about empowering them so that they understand what their health and safety duties are, so that they can push further back up on management to say what you're asking me to do is actually not in compliance with the law, and giving them the skills to be able to deal with more senior levels of management. We also do a whole heap of all employee training. So that's about, again, about making sure that workers feel comfortable about how they raise health and safety issues around mental health, how they support their health and safety reps. So it's not literally rolling up to your health and safety rep with a problem without also ensuring that you're supporting them to bring about the solution. So it doesn't be seen as sort of an individual issue, something that collectively we can all deal with. So that's some of the work that we're doing at the moment. I know we're keen to work with Unions WA around how we bring some of that stuff here. So finally, in terms of our Mind Your Head stuff, some of the key messages to take away are really, firstly, that health and safety means health and safety not just in terms of physical health, but also in terms of mental health. And the same priority should be placed on mental health as there is on physical health. The second thing is that the laws are changing here. Over the next 2 years, you're going to have huge opportunity in your workplaces to push your employers to take greater action to protect workers' mental health. They will have new obligations to ensure workers' mental health that should provide you with really good leverage to get better outcomes in terms of workers. And really what Mind Your Head is about, it's about assisting workers. It's about making sure that you have the skills to be able to raise health and safety issues and get better action in relation to mental health. There is a QR code to use it. It's an opportunity to sign up for more updates and information around it. And this just gives you a bit of an idea about some of the organisations that are currently helping deliver Mind Your Head. We are supported by the biggest workers' compensation claims manager in the country, EML. Obviously, we have a clear alignment in terms of wanting to reduce mental health workers' comp matters. We want to do that by preventing injuries in workplaces. I think one thing to note about mental health is that there are a lot of different people out there selling their wares on mental health, in particular workplace mental health. There's some really good peer support programs, and I see mates are up the back there. They are great at being able to assist and identify people that are struggling with poor mental health and helping people on how to approach them. There are not a lot of people out there doing anything on prevention. And as unionists and as health and safety reps, that's fundamentally what we're about. We want to prevent injuries, whether they be physical or psychological, and this program is very much focused around that. As I said before, it's supported by Victorian WorkSafe and their WorkWell program and our research partners at the University of South Australia. So we'll hopefully be publishing some of this data in the next couple of months and really looking forward to a few questions on that and engaging with you in the future. So I might leave it there.